The rural Bangladesh has undergone radical transformations in the last decades. The villages have become more resilient, resources become more useful, farmers are adapting modern agricultural practices. Markets are gradually becoming more inclusive and healthy, and respectful living of men and women are being restored. Yet, there are some regional vulnerable pockets characterized by low agricultural productivity, lack of technical knowledge, scarcity of resources. Therefore, the population suffers from not being able to respond to the market demands. This situation further worsened by seasonal natural disasters and limited access to basic social services. Shomoshty project started to work with 180,000 families on increasing livelihood options and social capital. Starting from the year 2016, a change is being seen in those rural households who have now access to improved businesses and social services, along with responsive public and private service providers. The producers are now gradually becoming able to access market development services, while their households have been gaining the capacity to access social services and savings mechanism. Market actors and local government are providing support to expand value-added inputs and services for farm and off-farm producer households to make this change happen.
কমিটির মাঝে 20 জন সদস্য আছে, এর মধ্যে 2 জন দলনেতা বানানো হয়েছে।
বাজার থেকে আমাদের মোবাইলে এসএমএস জানিয়ে দেয়, তখন আমরা কাংড়া রেট জানতে পেরে কাংড়া উঠিয়ে বিক্রি করে দিই।
আমি প্রতিদিন 10 থেকে 15-20 জন, এমনকি রাত 8টা-9টা পর্যন্ত আমাকে সার্ভিস করতে হয়।
With the aim to develop a sustainable delivery channel integrating market and social services, the project has taken a pro-poor market systems approach, popularly known as M4P. The project is helping the market actors to reach out to the poor and disadvantaged market segments to increase agricultural productivity in vegetables, bull fattening, dairy, crab, duck, and lemon subsectors. On the other hand, the project is facilitating public service provision through health, micro-health insurance, and sanitation to make social services easily accessible and ensuring access to formal financial services through involving private sector partners to this vulnerable population to ensure sustenance of income. Through this integration, Shomoshty has designed interventions to enable the poor, disadvantaged, and women to have equitable provision and access to market and social services.
সঞ্চয় করার ট্রেনিং পাইছি, এরপরে স্বাস্থ্য কমিউনিটি ক্লিনিকের ট্রেনিং পাইছি।
এসিএ হিসেবে আমি উপজেলা থেকে প্রশিক্ষণ পেয়ে কমিউনিটিতে এসে মহিলাদের সেসব বিষয়ে উদ্বুদ্ধ করি।
বাজারের কমিটি আছে নিরাপত্তার জন্য।
Evidences from the field shows Shomoshty's footprint in changing the scenario by creating more opportunities for these vulnerable groups through effective engagement with the private and public sector stakeholders. This is reinforced by the active participation of the community people and the last-mile service providers who are being empowered to work as pressure groups, maintaining sustainability of the improved service delivery channels.